Welcome to PHA 205. The official name of the course is Statistics for Health Professionals. Another widely used title is Introduction to Biostatistics. In this course, we're going to cover an introduction to biostatistics, but in this specific lecture, I'm going to try and make an understanding of why we cover statistics in the health field, and in fact, in any kind of field, why there is a need for statistics, how do we use it? Okay, so the first thing is um, that the fact that in health or in any kind of field, there is always a need to generate new information or to evaluate information that we already know, to check if what we know is correct, and also to come up with solutions to new problems. Basically, all of this could be under a big umbrella of something called research. So, whenever we're doing research, research has different components, and the component of research is the research design. And this is basically how are you going to go about doing your research? What kind of design? Is it going to be an experimental or non experimental? And even if it's an experimental, then will you do what we call randomization or not? Specific details that I'm not going to go into. You will also specify what kind of sampling strategy will you use. Are you going to take volunteers? Are you going to take a simple random sample, for example? You will specify the mechanism of data collection. So, are you going to do face-to-face interview? Are you just going to call people over the phone? You will specify also the type of instruments that you will use. So, for example, will you use a scale to measure people's weight, or are you just going to ask them how much do they weigh? As an example, are you going to take blood samples or not? All of this falls onto what I call research designs, the plan of the research. But once the research starts to be implemented and you start collecting data, the information that you covered, that you collected, needs to be analyzed. And that's where statistics comes into the play. So statistics is a big part of research, and that is a tool that allows you to understand the information collected. In fact, we use statistics for two major things. The two major things we use statistics for are one, what I call it is estimation. So we have a section of statistics that is called estimation. And the second part of statistics that we use is what is called inferential statistics. And basically, that's where you're going to answer a research question. Hala. To be complete, I have to say that also statistics is used to figure out the fact that we're going to use a sample instead of a population, what kind of sample we were going to use, how big the sample size. But our focus in this course is going to be about these two arms of statistics. So statistics have two big arms. One arm is called the estimation, and the second arm is called the inferential statistics. And basically, estimation is just when you estimate a value, and inferential is when you answer a research question. So I have an example here. Estimation, the average number of kilos lost after dieting for 6 weeks. You estimate that value. And then the research question would be, does Reddick-Tile help reduce weight? And therefore the answer would be yes, it does, or no, it does not. Okay? So basically, again, this is a brief introduction to why we use statistics, what is the role of statistics in research. So again, statistics is important because research is important. Research is important because it helps us generate new information needed. And therefore, statistics is also part of research. And we use it to summarize the data, to present the data, which is part of estimation, and also to answer a research question that we run the study for. So, so at this point, it would be helpful if you can think of a research problem and see how we can apply this idea as we just covered. A simple research problem, for example, if you're interested in studying how do students at LAU feel about smoking on campus. So the question, we start with the parts of the research design. What kind of design you want to do? For example, we may decide that we just want to do a cross survey. That's one of the designs available. So you decide that you're going to take a sample out of the LAU population. So what kind of samples are you going to take? Are you just going to go on campus and walk around and talk to students? That's a possibility. And then how are you going to collect the information? Maybe you're going to talk to them face to face, and then you'll have a list of questions that you're going to ask them. Let me at this point introduce a word which is called variable. So every time you ask a question, you may ask them, for example, what is your major? What is your gender? How old are you? Have you transferred from a different university or not? What campus are you studying on? How do you feel about smoking on campus? Do you smoke yourself or not? Do you come from a family of smokers? Okay, so every question we translate it into what is called a variable. So you will have a variable that is called age, you will have a variable that is called gender, you will have a variable that is called, for example, what the campus on which they're studying. There would be a variable on have they transferred from different campus or not. So every question we turn it into a variable. So whenever you hear me talk about a variable, think about originally where this is coming from. It's coming from a question that was asked to participants, and that question is now called a variable. So for example, GPA would be a variable, major would be a variable, if they're sophomore or so year at the university, sophomore or senior, it would be a variable. And the answer to that question would be a data point. So a variable age, the answer to that variable would be, for example, 18, 19, 20. Every person will have their own answer to that question. Okay? And this is why it's called a variable, by the way, because it varies from person to person. The answer varies from person to person, and therefore it's called a variable. So, for example, if we talk about variable age, the data point for variable age would be 2021 مثل ما قلنا من شوي. If we're talking about variable gender, the answer to that would be male, female. Variable, for example, major, biology, pharmacy, nursing, etc. A variable campus, it's either Beirut or Byblos. Variable, do you smoke? It's yes or no. And then, for example, for those that smoke, frequency of smoking, for example, on a daily basis, on a weekly basis, or مثلا occasional smokers. All right, so I hope you've seen, now you realize what is a variable, and the answer to that variable is called a data point. Okay, let's continue with our introduction. The next thing is to introduce a few concepts, and the concepts are population and a sample. All right, so in research, we study a certain population. So, for example, an example I just gave a moment ago, our population were LAU students. And you were not going to talk to all LAU students, you were going to talk just you were going to talk to a sample of that population. And therefore, you take a subsection of the population and you study, and that would be your sample. So generally speaking, a population, هن كل elements, I'm saying elements, it could be people, it could be anything, depending upon what you're studying. So all the elements that meet a certain criteria that you set depending upon your research question. So if you want to study LAU students, the criteria would be to be LAU students. If you decide to study, for example, those that suffer from migraine, then your population would be any person, all the people suffering from migraine. Okay, so that is your population. And out of that population, you take a subgroup that comes from that specific population, and that is called your sample. Okay, now the process through which you take that subgroup is called sampling, and there are different types of sampling. The samplings that are called probabilistic samples وفي non-probabilistic samples. Again, this is not the topic of this course, but I'm introducing the concept. The best samples are probabilistic, and these are samples that would produce a sample that is representative of the population, يعني a sample that resembles the population. Once you have the sample, you can study that sample, okay, and you collect information on that sample, and using the statistical tools that we will cover in this course, then you can go back with an estimation and an inferential. Remember, I said statistics have two major arms, estimation and inferential. So using the sample, you will estimate the values that are in the population, and using statistics, you will infer a conclusion about a question asked about the population. All right. So before I continue, let me just also note something. Values in the population, we refer to them as parameters. Values in the sample, we refer to them as statistics. Okay? So for example, the average of, let's say, blood pressure in the population, that's a parameter. The average that you calculated in the sample, that would be your statistic. So that's first thing. Values in population are called parameters, and the samples are called statistic. The second thing, we write the values of the population using Greek letters. All right, so you may see me writing mu. Let me see if I can do some work here. Yellow. All right, so I said in the population, the values, so pop for population, and this is sample. Okay, so the values that are in the population, these are called parameters. Okay, so the average is a parameter in the if it's in the population, but the same average, if you calculate it in the sample, it will be considered as statistic. Okay, statistics, and you will excuse my handwriting. Okay, so again, the average, or what we call in statistics the mean, that's a better way. Okay, the mean of the population, we write it using mu, whereas in the sample, we write it using x bar. Another example would be the standard deviation. So this is a standard deviation, and I'll explain what is that in future lecture. The standard deviation in the population, we write it as sigma, whereas in the sample, we write it as simple s. One more example, a percentage or a proportion, proportion. So percentage or proportion, it's the same thing. In the population, we write it as pi, whereas in the sample, we write it as small p. Some books, they write the proportion in the population as capital P. Okay, but نحن we're going to stick with this way of writing things, the Greek letters. So mu, sigma, and pi for the population. The same things, if they're calculated in the sample, they would be x bar, s, and p. All right, so far, two things, parameter statistics and how we write them. Then the other thing that I want to mention is that what links the statistics to the parameters? Simply, the statistics are estimates of the parameters, okay? Because most of the time, these values, the values in the population, are not known. They're not known because rarely we study the population. Very rarely we study the population. Most of the time, we study samples. So most of the time, we do not know the values in the population. We do not know what's the average of everybody, for example, who is diabetic. We cannot do that. So what we do is we take a sample of diabetic patients, we measure their blood pressure, we calculate an average in the sample, and that average in the sample would be our estimate of the value in the population. Okay? All right, so I hope that kind of like does a quick summary. Let's continue with our slides. The next slide is just an example. So you have here all patients with high cholesterol, high levels of cholesterol. This is the population. We do not study all of them. Rather, we take a sample. So for example, 50 patients. So the way we took them is in this specific example, I'm picking volunteers. And RCT, RCT stands for randomized clinical trial. You don't have to know it, but I mention it. And remember, we used the information in the sample for two reasons: to estimate and for inferential. So for example, in this example, let's say we took a sample and we gave them a drug and we want to see does the drug reduces the cholesterol. So the estimation would be the average reduction in cholesterol. That's my estimation. And the inferential would be answering the research question, does Lipitor help control cholesterol? So Lipitor is a drug that reduces cholesterol. Okay, so that's an example. Let's do another example. Um, that's the slide where I talk about parameters and statistics, as I did a moment ago. So characteristics of population are called parameters. The same value, not the same values, the same things, the same characteristics calculated in the sample are statistics. Yani the average or the mean here is mu. The mean here is a statistics. Statistics are used to estimate the values of the parameters. Yani if I ask you what is the real value, the real value is the value of the population. That's the real one. Whereas the values in the sample are just estimations of the values in the population. Okay? All right, so here's another example. Average survival year of patient diagnosed with brain cancer. So I need to know everybody who ever had brain cancer to calculate their average survival in years to be able to get the real value, which is not feasible. So instead, I take a sample of a number of patients that have brain cancer and I calculate their survival and I come up with 36 months. So 36 months is not the population average, but it's my best estimate of the population. That's the best thing I can do so far. Okay, let's look at another example. So here's another example. Percent of patients suffering from complication after an open heart surgery. That's in a population. For me to answer that question, I would have to take all the patients that ever had open heart surgery and look at how many had complications. Again, this is not feasible. So what I do is I get a sample, and let's say in my sample I observed 12% complication. This 12% is not the population percentage, but it's the best estimate. Okay. So you remember that there are other examples. So for example, here, and I'm showing an example that during election years, the CNN, Fox News, and other news agencies may do what we call polls. Polls basically is a survey. They're going to call people and they're going to ask them if they're going to vote and who are they going to vote for. So for if we're thinking about the US, the population of interest are US citizens that are above a certain age, meaning that they actually can vote. That would be your population. And a sample would be, let's say, 1,000 people that CNN called and asked them if they're going to uh, vote or not, and to whom they're going to vote. Okay, so mind you, this is one of the very few examples where the population value will be known at a certain time, because at a certain time the election will occur and the population will vote, and the end value would be the actual population parameter value. So another example where the population value would be known is when census are done. Census is counting everybody. In the US, every 10 years there is a census. In 2020, this year, there was supposed to be a census. 2010, there was a census. Year 2000, there was a census. A census is counting everybody on the US soil, and they would look, for example, at their race. So the values that you get out of the race, so the percent of blacks upon a census is not a statistic, it's an actual parameter because everybody has been counted for. Okay? Example, if the average length of stay of patient undergoing CABG, so CABG is coronary artery bypass graft, is 11 days, do you expect the average calculated from the sample to be? So when I say if the average length of stay of a patient is 11 days, I'm giving you actually the parameter. So 11 days is the actual parameter. Okay, that's not how usually the order of things happen, but I'm doing it here this way so that you understand what I mean. Do you expect the average calculated from the sample to be exactly equal to 11 days, close to 11 days, more than 11 days, less than 11 days? The key to answering this question is to understand that what you're calculating in a sample is an estimate, a statistic, an estimate. So an estimate is never exactly equal to the real value, but hopefully it will be very close. So the correct answer is close to 11 days. So more on estimate. So the sample is used to calculate statistics that are used to estimate the population parameter. We've said that more than once. The statistics are expected to be close to the parameters, but not necessarily equal. And different samples can yield different estimate of the same parameters, but hopefully they will be close to one another. Every time you take a different sample, but from the same population, you will calculate a new estimate, and hopefully that estimate is still trying to estimate the real value in the population, and therefore it will be close to the real population, but it will be a different value. And I have an illustration here. So let's think about the population where we're looking at average blood pressure, mean blood pressure, and let's say the real value is 120. So this 120 is a a real value. If I were to take different samples, and in every sample I'm to calculate the average blood pressure, so that is an X bar, not mu, that's an X bar. So I do it in the first sample, I do it in the second sample, the third, and the fourth. Since these samples are different samples, but they are coming from the same population, the estimate they generate are going to be different estimate, but they all will be similar to 120, and therefore they will be close to one another. Okay? So the key question is, why do we use sample rather than using the entire population? And the answer to that is that it's less expensive, it's easier, it's faster, it's doable, because sometimes you cannot actually measure the entire population. But probably the most important part is that from the samples you get valid results. What I mean by that is that the estimates you get are good estimates. Okay? All right. The last thing that I would like to conclude this introduction is that the thing about samples is that the minute you start using samples, then there is the concept of probability or chance that comes into the play. And therefore, we have to have a good understanding of a probability. So we will cover, not now, but in few lectures, we will talk about probability. And the idea behind talking about probability is just to give you a little bit of background. So once we start tying up probability to sample, in our work of estimation, you will have a good understanding of what we're doing. Okay? All right, so that concludes this pre-first lecture. I hope it was clear.